have to keep in mind that most people are asymptomatic or mild symptom, but because the number of ICU beds in Thailand also limited as well. So we had heard the expert call for increasing number of ICU beds before, and today Dr. Thavisin also reiterated the same thing. He said that the daily surge will impact public health services, and noting that the current number of current ICU beds in all general hospitals is not sufficient to cope with the demand and must be increased. There are 262 ICU beds in Bangkok, 69 of which are unoccupied, plus 479 negative pressure rooms, with 69 of them still unoccupied. At an example rate of 1,500 new infections a day, Dr. Thavisin explained that 52 ICU beds would be needed nationwide each day, including as many as 13 ICU beds for Bangkok, and adding that all available ICU beds in all hospitals will be fully occupied in the next 6 to 8 days. He also said that officials are discussing increasing ICU wards in general and field hospitals to cope with the anticipated increase in the number of severe cases, with the state-run Rajvithi Hospital taking the lead. The CCSA spokesperson also apologized to the public for the long wait when dialing the COVID-19 hotlines. He asked the public to provide important information such as contact numbers and their COVID-19 testing details through the hotline 1668, 1669, and 1330. He explained that additional phone lines have already been added to help meet demands. At the moment, 1,423 patients are still waiting for their hospital beds, including 264 more patients in the past 24 hours, while 474 have been admitted to the hospitals already. And the Ministry of Higher Education, Science, Research and Innovation say that its minister, Anek Lauthamathat, has asked medical schools under its administration to send their students to man the hotlines to solve the issue of calls to 1668 and 1669 going unanswered. So the Ministry's of Permanent Secretary, Dr. Sirirek Songsivilai, also said that they have set up 41 field hospitals across the country with a total of 12,000 beds and medical personnel ready to accommodate COVID-19 patients. There are also 22 medical schools ready to help patients in a critical condition and who require ventilators.